This week, the intern doctors started their industrial action demanding the Ministry of Health to clear their salary arrears and to ensure that salary discrepancies in the sector solved. During today's plenary sitting, Speaker of Parliament Anita asked the Ministry of Health to handle the issue without fail.
So I request the Minister and government to ensure that we see how we can solve this problem so that we have the medics do their work without any interruption. So we will ask the Minister of Health to come and update this House on how far, the Minister is here, how far you've gone with the issue of the strike and whether it is true.
Margaret Muhanga, the State Minister for Primary Healthcare, told Parliament that the arrears were cleared and the striking medics had called off the strike.
Honourable Speaker, the interns have been paid to date and there's nothing that is left to be paid to them, and the strike was called off. The dentists and doctors were paid 2.5 million, the pharmacists 2 million, nurses and midwives 1.5.
However, Muhanga's submission was contested by members of Parliament.
Will you explain to this House, Honourable Minister, how many lives were lost out of that negligence, and who should we really demand to account? Because right, Honourable Speaker, for the minister to simply casually come here and explain that they have after all paid, when people are complaining about patients not attended to because somebody is casually attending to duty, is unacceptable.
That they have never been paid. They have never been paid. Even after a pronouncement that they were paid for September and October, they have never been paid. They have not even called off a strike. They have not even been met.
Right, Honourable Speaker, it is very important that among these ministers, we find out who is playing with the House after deliberating ourselves to allocate money, and they come here, they start playing around.
The interns that do all this work. When you are in Kampala, at least we can talk about, but go outside Kampala. Even this little money that we are talking about, they don't get it.
A year ago, President Museveni promised to increase the salaries of all medical workers depending on their expertise and experience. The increment was supposed to start during the 2022-2023 financial year after the exchanges among directed Muhanga to table evidence before Parliament showing the payment of the salary arrears. Acheng has to produce the evidence by tomorrow.
We need a comprehensive statement in this House tomorrow, which we will debate. We also want evidence of payment that should be laid on table, and we want evidence that finance did not release all the money.
Every year, public servants in the medical sector have been involved in strikes over low salaries, late payment, and poor working conditions. Sarah Nakandi, CTV, PM Edition.